Tell me, Maheka, what made you go in for MCAN?
I've had a personal loss in my family due to cancer. This is now going to be 10 years. Um, and the family goes through a very emotional and a financial drain. And it was a very trying time for me because we realized that we had no control of it. And I then decided in my way, whatever I can do to help the cancer treatment for patients who can't afford this, I would help in my best of capacity. And in 2013, I walked into the hospital and I met Dr. Anil De Cruz, and I said to him that I would like to help in whichever way I can in my capacity. And he said to me that he was very humble and very sweet, and he says like, you are an angel who has walked into the hospital. I still remember those days. And then he said, I will give you a section which you take over for head and neck, because my brother-in-law passed over with throat cancer, and that's the reason we are doing head and neck cancer, because he was nearly 42. It was a very young death in the family, and my sister was a widow at a very young age, and in that same year my dad passed away to pancreatic cancer. So ever since then, it's been a beautiful journey with the Tata Memorial. It's been 10 years. I host a fundraiser for them. And through my avenues and contacts, I try and raise whatever I can and give them direct to the Tata Memorial for the treatment of the head and neck patients here.
Doctor, what is the importance of head and neck patients in cancer? Is there a lot of patients who are coming
Yeah.
in?
So the Indian subcontinent, head and neck is the most common cancer. 25 to 30% of all the patients that walk into this hospital suffer from head and neck cancer. So the problem is that huge, and especially in our country, oral cancer, because of the habit of chewing tobacco, oral tobacco chewing. So oral cancer is the highest. We also get a lot of voice box cancer, the larynx and the hypopharynx cancer. So yeah, head and neck is the major problem, and majority of them come from the lower socio-economic strata. So they require a lot of financial help to go through their entire treatment. So this fund helps us in many ways for our patients completing their treatment.
If you put it in figures, on an average, how many head and neck patients normally walk into Tata?
So we see about 10 to 11,000 new patients of head and neck cancer every year, which goes on increasing by 10 to 12% every year. So the exponential rise, it's going to rise over the next few years. And we operate around 2,000 to 3,000 major cases, and we are limited by the operating rooms we have, because a lot more patients require surgery. We can't service them because of the limited space that we have. But yes, we operate about 2,500, 3,000 major cases every year.
On an average, from what MCAN raises for you, how many patients are you actually able to treat?
Right. So when we started in 2013, when Maheka, we started the first fundraiser, we identified an area in head and neck cancer where people with voice box cancer, we had to remove their voice boxes, and to give them speech, we required a valve, which costs about 25 to 30,000. It's not the initial cost of the valve that is the problem. The problem is it has to be replaced every 3 to 6 months because it can become faulty. And that is the time when people could not afford this frequent replacement. And that is where we utilized the funds initially. And since then, there has not been a single patient who's not got a valve because of lack of funds. So that's what MCAN has achieved over the years. Any patient will receive their complete treatment. Nobody will have lack of treatment because of financial problems. You see, the government subsidizes a lot of treatment at the Tata hospital. So we get a lot of subsidies for the patient. But yet they have to spend on certain things such as antibiotics, certain prostheses that we require. So they have to spend certain money. So from that, from using it for voice prostheses, we also started using this. See, cancer treatment is not only surgery. It is surgery, sometimes chemotherapy, or combination of chemotherapy and radiation therapy. So then we started using it for all our patients. Those who got complicated, required higher antibiotics, we used it for them. We used it for people on chemotherapy to go through their treatment. They require a lot of supportive care, nutrition, certain factors that are required to get their blood count up. So we started using it for all patients. So because of that, all the patients complete their treatment, and the treatment is not incomplete because of lack of funds. And that is what MCAN has done over the last 10 years.
You tell me, Maheka, how does it feel to lend voices to the voiceless? You're actually doing that.
Yeah, it's a beautiful feeling. You feel like, I mean, it's like this hospital is, they work so hard, every doctor over here, selflessly, to try and make sure every patient is cured and left from here. And when we achieved this voice prosthesis a couple of years back by lending a voice to every patient who leaves from here, it's a beautiful feeling because, like he rightfully said, head and neck cancer is mostly in the low economic strata. So their only way to communicate is through their voice because half of them are illiterate. So how will you communicate if you don't even have a voice and you can't even write? So it is like the joy on their faces. We have interacted with them. It's a beautiful feeling. It's something that it's just I take back home and I feel like whatever I can do, I will keep trying to just see a smile on their face and a beautiful voice that they have achieved. And now every patient leaves with a voice. So it's very humbling to know we have managed to achieve this.
How much money have you actually managed to raise over the last 10 years?
We've handed over nearly about 8 crores to them, and it's the support. I can't say single-handedly I've done it. MCAN works as a team. The people have patiently waited year after year, even in COVID, which was a challenging time for everybody. People lost their jobs. There was a very uncertainty in everybody's mind, and we didn't know our way forward. And yet, even at that time, when I came to the hospital, doctor told me that, no, Maheka, we will do the show in whatever capacity because we need every fund. We are already dealing with cancer, which is so tragic, and now we have COVID. And they didn't even have a luxury of fear because they were working every day, single day in a time when COVID was spreading. It was a moment I will never forget, and that's why even in 2020 I did it online. And today we're going to be doing the show after 3 years, a physical show. And I'm really looking forward to raising much more for them because it is our 10th year for the MCAN with the Tata Memorial. It is a landmark. And I think we should celebrate this journey together.
Absolutely.
We have achieved a lot, but there's yet lots more to achieve. But being in this beautiful journey marks for a reason for us to come together and have this fundraiser this year.
Yeah, so Maheka, let me tell you one thing. It's been an amazing journey the last 10 years. The funds have gone up every year. And firstly, I would like to thank all the donors because I have attended most of the functions
Yes.
that you did. And I have seen those donors come year after year and donate money for this good cause. And Maheka has been working tirelessly to get this organized. It's a big effort to get people together, to get money for it. But she's been doing it for 10 years and I'm sure she'll continue for many more years to come. And because of that and because of my confidence in her, we have expanded the use. So Tata and our director, Dr. Pramesh, will talk to you, has opened up branches all over India because, it's difficult for patients to travel all the way to Mumbai. So now we have a branch in Mullapur, which is Punjab, Varanasi, in the east at B. Barua Cancer Center in Assam, Guwahati, and we have one in Vizag, which is in the south. So we started using MCAN funds for some patients there who are really not affording. So these centers also now we have started using the funds.
Amazing.
So Maheka, it's now your added responsibility to not only limit yourself to Mumbai but help patients from all over India, all over the country.
One last question, sir. I want to know from you, the 8 crores that were generated, how many patients did they actually cater to and how many more do you actually need considering you're saying it's going to go up and COVID has had a lot of patients not taking treatment?
Right. So it's about 300 to 400 patients every year or a little more than that. So what we do is we don't give anything absolutely free. We tell the patient because anything that is given free, nobody values it. So the patient pays a little bit and these are patients who really are in the lower socioeconomic strata. They can't afford their treatment. So it's about 400, 500 patients every year that we help, sometimes more, depending on the need. But yeah, prosthesis, we operate around 100 to 120 patients every year. And some people come year after year for change. So they are helped. So it's been more than, I think, 2,000-3,000 patients that we've helped so far. And we continue to do that. And now, as I said, it's pan-India. So there's no limit to the number of patients that will require this help from us.
On an average, what is the kind of funds you think will be able to help all these people?
So, well, it's a bottomless pit, right? Because there's so many patients who come who require chemotherapy, antibiotics. But the funds we generate are judiciously used so that absolutely the needy get these funds. And every year that we generated the funds, usually they are sufficient for that year. So every year we finish those funds in that, almost finish the funds in that year. So the more we generate, obviously the more people we'll be able to help. And since I told you now we are helping across India, I'm sure this will also stimulate people across India to have such similar fundraising events, and Maheka will probably guide them to do such similar events in various parts of the country, and it will help many more people. So,
what started with you as a personal loss and you wanted to contribute back has grown wings, you know.
It has.
And considering the need is also growing, and the hospital along with you is now trying to help more patients. What do you have in mind?
It's a beautiful journey. When I started this, I really didn't realize I would be here for such a long time. And just the year after year, it's just, I think when you're selflessly just giving, and you see, when I come here and I see the result of it, it just makes me want to do more. I reach out to my donors every year, and they tell me, Maheka, we are waiting, your Tata check is ready, when do we come, when do we give it? So it just makes me feel so, I'm doing something so right, that I feel my dad has chosen me like a path forward, and he is just showing me the way because he believed a lot in charity. And I just feel I'm the Zaria to reach out to people. I'm just a person they need to just put forward. The monies are going direct to them. The monies are going in the name of Tata. I'm just literally just the face in front of it. That's about it. So for me, I just feel it's the person or the donor just comes towards me and like, Maheka, let's go to Tata, I want to help. Or Maheka, what do you need? And it makes me feel so full as a person because there's a soul to it. There's more to life. And if I have been able to achieve it and given a smile or a life or a hope to a family, I think there's nothing more I can ask for. It's very gratifying, and I feel very happy I was chosen to do this for them.
Anything else, sir?
now I mean, we like to thank Maheka and all the donors, because for all these years, all our patients have benefited from this, and I hope it continues for many more years to come, and many more patients get benefited by this.
Thank you.